Good morning, you guys. Welcome back to my channel. Today's video, I am so excited to film because I'm so ready to talk about it. I'm ready to sit down. I'm ready to tell you guys all about my experience. I'm on cloud 9. I am finally done with internship, with clinicals in nursing school. I'm finished, done. So I'm ready to sit down and talk to you guys and tell you all of my tips, advice, things I want future nursing students, current nursing students, going into your last semester, going into your internship, preceptorship, things I want you to know in my experience. So I thought I'd start it out with an intro. I don't know what my voice is doing, but I slept in this morning, which is awesome, but my body woke me up at 6:45 and I like literally rolled over, looked at my phone. I'm like, excuse me, you don't have to be anywhere at 7 a.m. today, so you can just go back to bed. So I did, and then I woke up, I sat on my cozy little couch and I had a cup of coffee. And I'm currently in some kind of dilemma. I can't decide if I want to decorate for Christmas yet because I know my Christmas tree is going to have to go here, but I don't want to move my mirror and I'm kind of sad about it. And also, I am like in a dilemma. Like, I don't know if I want to take down my cute fall stuff. Like, I'm thinking, because I'm having a Friendsgiving, so I'm thinking like I just have my fall stuff and it's not Thanksgiving yet. And I can't decide if I'm ready to take it all down. So that's another thing that I'm dealing with today. But I'm gonna go get a workout in at the gym. Haven't worked out since Tuesday, so 3 days. And I'm ready to get back into a routine. I'm ready to feel good. I'm in a great mood. You guys can probably sense that, but you don't understand the feeling of being done. Like it's insane. I literally cried yesterday. But anyways, I hope you guys are excited for this video. Make sure you are subscribed so you get notifications. Tons of content coming, you guys, tons. I am ready to sit down and film lots. Make sure you give this video a thumbs up if you are excited and ready to watch, and let's get into the video. You guys, I have been messing with my hair so much lately in the sense that I don't know if I want to keep my part like that or run with the middle part that I've been trying to work, but I just don't feel like it's me. And please disregard my hair being orange. It's a really big headache. I'm trying to get it fixed. Being a blonde and being actually not a blonde is a difficult thing. So I think for the video's sake, I'm going to have it this way. For everybody who gets annoyed with my hair playing, I'm really sorry. Okay, you guys, so today is November 3rd. I am completely finished with internship in nursing school. All clinicals in hospital setting is done. And if you follow me on social media, you probably already knew this, but I wanted to film an entire video about my clinical experience. And basically this is all tips for clinical nursing school, period. I want to give you guys the best of the best advice and what I have learned from my personal experience. Obviously, all schools are going to do internship differently. You may not have a preceptor. You may not have the ability to choose where you go. You may not have the same situations as me, but I'm going to kind of break it down for you and give you what I think you should do before internship, what I think you should do in internship, the things I learned, what I loved, and basically a whole video about it. So here we are. Just a little update for you guys. If you have never seen my videos before, my name is Holly. Hi, what's up? I'm happy you're here. I am in my 5th year of college. Technically 4.5 years will be my degree, but this is actually me going into my 5th. My program is 2.5 years of nursing school and 2 years of prereqs for my BSN. I graduate on December 14th of this year, and I will be taking my boards immediately after that. So that is kind of where I'm at. If you love nursing school videos, subscribe because I make lots. And I love to share my experience. I'm blunt, I'm open, I'm honest, and I'm here to tell you what's up. So my experience, I started my internship this semester on September 15th I started, and basically you schedule it yourself. So we had to complete 135 hours total for clinical this semester for my internship class. I had a gero clinical, I had a community clinical as well, and those are basically done. But the main hospital grind of the grind, gotta be a nurse, med surg clinical was internship. And I completed mine at the University of Iowa Hospitals, and I did get a random preceptor assignment, and that's just how my school does it. We got to choose a preference, and I chose to be at the university. I didn't care where I was or what I was doing. I wanted to be at the University of Iowa just because that is where I want to work one day. I don't, if regardless of Sam and I moving to Chicago, end of the day, where I'm going to completely plant my roots is going to be in Iowa. That's the plan, life changes. But I wanted the experience. I wanted to be in a big hospital. I wanted to push myself. A lot of people stayed at Allen Hospital, which was perfectly fine and great. I just felt so comfortable at that hospital. I work there, I had my clinicals there, and I just wanted to be pushed. I wanted to really test my skills and be somewhere else. So I chose to go out of the hospital. Did that require me to drive a lot? Yes. Did that require me to spend money? Yes. I had to pay $20 each time I parked there. Each time, because I parked in the ramp. I wasn't technically supposed to, but I did, just because I didn't want to take the bus and do all this stuff. So yes, it cost me more money. Yes, it was a little bit more of a hassle. Yes, it was more tiring, but was it worth it? Yeah, it was the best experience of my life. So I got put at Iowa, and I don't want to say the floor I was on just because my preceptor, and I just don't want to put that out there, but I worked on an internal medicine unit. So, I mean, you can probably figure it out, but I'm just not going to be like, hey, I worked exactly here. And that's why I didn't do it before, but it's an internal medicine unit. It is med-surg, but it's not. It's a little bit more complex, and the patients are 12 times more complex than just your basic med-surg patient. Most of the time, I would have all 4 patients that literally had crazy things wrong with them, and it was the coolest thing ever. Like, there were so many opportunities to learn, and it was amazing to step away from a small hospital and be in the big guns where it's like, holy shit, there's residents, there's doctors, there's respiratory therapists everywhere, there's for codes like 1 million people come, like there's just people everywhere. So for internship, I have a big sheet here to tell you guys about, but I just want to tell you about some things that I saw that I wrote down. I saw way more than this, but this was just some of the things that I did see. I saw refeeding syndrome, TPN, diabetes 1 and 2, ERCPs, thoracentesis, hypoxia, hypo everything. Literally every single hypo you could think of, I saw it. Herpes simplex, airborne precautions, droplet precautions, contact precautions, GI precautions, TB, insulin drips, blood draws for labs, straight casts, catheters. This was just a Hickman, ports, B-cell lymphoma. Like, these are just literally a few things that I just wrote down throughout the time. I was just trying to like remember certain things, and these were some things I was writing down yesterday when we had a little bit of a break. But I'm not kidding you. I know like the things that I learned at the hospital I was at with my school, and like I just felt like when I came to Iowa there was just so much more to see, and there was so much more going on, and I just was like, my nursing heart was just like, holy crap, this is amazing. So those were just some of the things. If you've heard of them in nursing school, it's way cooler when they're your freaking patient. You're taking care of them, you're giving them medications, you're getting them places and doing things with them. Way cooler. But a few things I want to talk about. So for internship, they are 12-hour shifts. It's not your typical clinical in nursing school where you may go 6, 8, 4 hours. I don't know. That's kind of, I believe we did 7-hour shifts for nursing school clinical. I never went a 12 until my 4th semester, which was called DEU, which was like the prep for internship kind of in a way, because you're more one-on-one with the nurse. But in internship, I was fully one-on-one with the nurse. The whole goal of internship is to make you transition from the role of a student to a nurse. You are in control. You have somebody standing there telling you, can answer every single question you have. You are basically on your own though. Like, you are supposed to figure it out and adjust and not have 20 million other students with you in the experience, so that you are able to see your skills and actually be able to put them to work. So my preceptor was absolutely incredible. I can't say enough good things about her. And the thing is I can't really say this on here yet, but there are some horror stories and people who didn't have great experiences. And I think it's just like to say something that internship can either make or break you. It can make you so confident and so like feel so good about your skills and let you thrive, become a butterfly, or it can literally put you into a ball and make you feel stupid and hate life and never want to show up to internship. I've seen both. So anyways, my preceptor was incredible. She was so patient, literally the nicest person I've ever met in my entire life. I can't thank her enough for how she made me feel during this experience. She literally, students, we have 1 million questions, and I really think that it's important to make sure that when preceptors are choosing to be preceptors, they know that they're about to deal with somebody who is going to ask continuous questions over and over and over and be scared and be nervous. And my preceptor took charge of that, and she did an incredible job. She pushed me when she needed to push me. At this hospital at Iowa, they do blood draws a lot, and at Allen, we never did that. I mean, I never went in and got labs for anything, but at Iowa, patients are so complex that the doctors will be like, I want a CBC now, I want a CMP now, I want a BMP, like I want this right now, like all throughout the day. So that's another thing I thought I'd mention. I worked days. Oh my God. But you know, we'd go in and do blood draws, and I mean, I'd done IVs and I'd had experience, but like not a lot. It was still really nerve-wracking. I didn't like feel totally comfortable starting IVs, or getting blood in a blood draw is just, you put the needle in and you're gonna draw it back with a syringe and put it into a vial so that they can like test it, you know, in the labs. And in the beginning, I was really nervous doing those things, and I would put it in the vein and I would think I'd get it, and then there'd be no flashback. And my preceptor would just sit there, and I'd like be looking to her like, please help me, like, can you like please come over here and like figure this out? She would just stare at me. She would literally just be like, you're fine, like you're gonna get it. And me, I'm just like, no, I'm not, dude. Like, come save me. Like, do this for me. Like, please help me. She didn't. And that was the best thing ever of her. And she did that in so many situations. She let me think for myself. She let me know my knowledge is there. And she pushed me. She freaking pushed me. And she taught me. And she was amazing and made the whole experience amazing. Anyways, so I want to talk about specialty versus med surg. And mine technically wasn't med surg, but it is med surg. It was med surg. But my school gave us the option to specialize or med surg. I didn't qualify to specialize. I didn't get the score I needed to get, which was fine with me as I did med surg. But to those of you who are choosing to specialize versus going to med surg, I highly, my nose is itchy and I put makeup on, highly recommend you do not specialize and you go and do a basic med surg internship. This is my opinion. You are more than welcome to disagree with me. I understand the people who want to specialize. I was one of those people, but after the experience and looking back, if I were to have had the opportunity to specialize, I would have not. Because as you go through nursing school, you have this, or when you start, you have this goal. You're like, hey, I'm gonna go be an OB nurse. I'm gonna go be a pediatric nurse. I'm gonna do this, I'm gonna do that. You have these little things in your mind that you think, and then you go through clinical and you see all these experiences and you're learning all of these different things, and maybe you still have that heart, like desire in your heart. Like, I still really love labor. I would be a labor nurse if I got the opportunity. But what nursing school did for me and what this internship did for me was open my eyes to the fact that being a med surg nurse or just a basic general floor nurse, they're the smartest people. I honestly, like, obviously in specializing, you are smart as hell too, but like in a specialization, it's only that specialty. You know what I mean? Like a general med surg nurse, and what my preceptor kind of like opened my eyes to in this floor was that they have to know and see everything. They see so many different things, and it's like such a good way for in your nursing school experience to be well-rounded, to be ready to take boards. Like, you are being quizzed on med surg. Like, that is the bulk of your boards, and you're gonna get peds questions, you're gonna get OB, you're gonna get mental health, all of that. But for nursing school, I'm just telling you, from my personal opinion, I highly recommend just doing basic med surg, because you're gonna get to utilize the skills you have learned. I mean, you don't sit there and know how to check some, I mean, we don't get taught a ton about OB and like what's gonna happen in OB and how you should do this in OB. It's like, no, you get a class on it and you need to know stuff, but it's not the bulk of the test, you know what I mean? So in this internship, I really got to utilize the skills that I've been learning over the years, and I really appreciated that. And it's just my opinion. My opinion. You're allowed to disagree with me. All the people who are gonna come at me in the comments about specializing. A lot of my friends specialized and they loved it. They actually really loved it, and that's fantastic. I'm just telling you my opinion. I really loved what I did. Basic. All around, saw everything, got to utilize everything. It was just incredible. Asking a million questions in internship. This is something that I want you to know you can do, and it's completely okay, and it is perfectly acceptable to do. I literally was so, from the beginning of day one, when I literally was terrified to touch a patient, not terrified to touch a patient, that's a complete lie. I was terrified to just, I don't know, like take the role of being the only nurse. That this was my patient, this was my patient, that was my patient too, and that was my patient, and I was the nurse. I was terrified, and so I needed to ask questions. I didn't know things. I didn't know how their pumps worked. Like, I got a training on it, but hell, I didn't know what the hell was going on. Like, I had to ask questions, and I want you to know that it's perfectly okay to do. And if you have a preceptor who's not allowing that, sit down with them and have a conversation, and you need to, like, you need to understand that you are the student and they are your teacher, and you are there to learn, and they are not there to discourage you. They're not there to make you feel stupid. They're there to help you. And I'm telling you, there are tons of amazing preceptors out there, and there's, you know, a handful of bad ones who shouldn't be doing it. But moral of my story is your preceptor knows you're going to ask questions. Most of them, what I'm saying, most of them know you're going to ask questions. Please don't be afraid to ask them. Ask a quadrillion questions, guys. I asked questions all day, every day, because I wanted to know them and I didn't know myself, or I was unsure. And if you're ever unsure, if you are ever unsure about something, please ask. This is a person's life. This is a person's vein that you're about to do a medication in by yourself. They're not standing there watching you anymore. Ask if you're unsure about something. I can't make that more clear that it is okay to ask questions. With your preceptor, this is, obviously I just said how amazing she was, but my tip for you, for your preceptor, is set boundaries in the beginning. Understand what she wants you to do, he wants you to do. If they're okay with you going into the rooms by yourself and giving meds, mine was completely okay with that, and you're able to do that. They're your preceptor, they're watching over you, and you're working under their license. So make boundaries, understand what their boundaries are and what they are going to allow you to do and what they're not. For example, my preceptor would have never let me just go just start blood and give it, even if I said like, oh, I'm comfortable with it, I've done it, which I hadn't done it by myself. But she would have never let me do that for the first time by myself. Like, if there was something that I hadn't done, she was perfectly comfortable with doing it and walking me through it as she had like showed me, if that makes sense. So we were really great with communication. That's really important. Make sure you have a communication with your preceptor. You need their cell phone number, hands down need their cell phone number, because if you're sick, if they're sick, if they get called off, if you're not allowed to come in, whatever, make sure you have their cell phone number and you guys have a way of communicating with each other, because it's key. I really think that's important. I want to talk a little bit about stress, because obviously that's going to come with this internship role. You're going to be very stressed out. Your days can be crazy. I swear to God, we literally had like 3 chill days out of the 11, 12-hour shifts we had. Like, we were consistently, like, we'd get admits, we'd be discharging, we'd have a million labs to get, we'd have assessments, we'd have meds. Sometimes we'd give meds at 2 o'clock that were due at 8. Like, it was nuts. And that is a thing in nursing. Like, it's perfectly okay. But just with dealing with the stress, I just want people to know that in your internship, it's okay to be scared, it's okay to feel stupid, it's okay to feel like you're less, but you're not, but it's okay to feel that you are. I felt really dumb a lot of times. Like, I made a lot of dumb nursing school mistakes. Like, if I can give you a couple examples, getting ready to give an IV med, and I'm pushing saline, and I like literally put the top of this, like the saline into the wrong, like literally it like wouldn't fit, and I'm like, why does this not fit? But it was like, Holly, you like need to unscrew it, like it's not unscrewed. Like, dumb things you do because you're stressed. Like, it's perfectly okay, it's perfectly normal. You are there to learn. This is where you make mistakes, is right here in internship. This is when you make mistakes. No, should you be making drugs? No, this is somebody's life. You need to be doing your 5 checks, you need to be doing your 3 writes, you need to be doing everything that you've been taught, because that's what you do. This is someone's life. And is everything you learn in nursing school is true in the real world? No, but you need to be safe, you need to be smart, and you need to be check your drugs a million times, like a quadrillion times. I'm not saying make mistakes there, but what I'm saying with the stress part, it's okay to feel stressed, it's okay to be scared, not know what you're doing. It's perfectly normal. It's going to be like that. I was so stressed so many times because I just felt like overwhelmed. Like, how am I ever gonna do this as a real nurse? It takes time. My preceptor looked at me. She's like, girl, everybody starts somewhere. You're going to be fine. You're doing amazing. Just breathe. And that's what I want you to do during internship when you feel like that. A couple of things that are important when you're on the floor, whatever floor you're on. Being a team player and making a good impression. When I say being a team player, where you are and what you're doing on your floor, maybe you are doing collaborative nursing, which means that you have collaborative nursing, I think that's what it's called, where you have techs or CNAs or nursing assistants. And I did at my floor in Iowa. And being a team player means if there's a call light and you're sitting there and you're not doing shit, go answer it. Just because this is your internship, like I work as a CNA, like I know what it's like you've been there. And if you haven't been there, be a team player. Like go answer the call lights. Like what I did when I would go to my floor during the day, I would find out who the nursing assistant was for my pod, and I would introduce myself and say, hey, if you need anything, please let me know. I have these patients, you know, let me know if you need help. That's being a team player. Going and answering call lights that aren't yours, that's being a team player. You are not any better than any person there on that floor. Every single person plays a role, and if you are going to sit there and be like, wow, this is my internship, like I graduate in December, I'm bad shit. It's like, no, you're not, like you haven't even passed your boards yet. Like go. And even if you did, like everybody answering call lights all the time, helping constantly. Like we're a team in the hospitals, and that's what I hope to continue to put out there from my YouTube channel, my Instagram. Like it's a team effort, guys. Like it's 100% a team effort, mentally, physically, emotionally. Be a team player on the floor you're on during internship. Next thing was making a good impression. I am telling you right now, if we do not move to Chicago, I am working on this floor. I want a job on the floor I was on. I absolutely loved it. And I had no idea I would. And that's crazy, right? Like you have no idea you're going to enjoy something until you do it and until you experience it. It's make a good impression, because maybe you want to work on the floor you're getting on, maybe you don't, but you never know. And making a good impression is the best thing to do with the managers. Like they're watching you. You may think they're not, but they are, and they're talking to your preceptor. They're talking about you and seeing how you're doing and seeing how the preceptor's doing. They know about you, so make a good impression. Keep up after yourself. You know, don't be having your cell phone out. Don't be doing dumb shit you shouldn't be doing. Just make a good impression of yourself. You're representing yourself and your school. It's really important. Okay, now I'm going to tell you a few things that I think you should have with you, study, prepare for going into internship. This is actually kind of a big deal for people who are going into internship. I would recommend that you know these things just because it's going to be a lot easier. Do you need to have them completely memorized? No, but if you have the time to do it because you're going to be a lot further ahead than someone who doesn't, because then this person who doesn't, aka me on some of these, needs to look them up and feel more insecure about them. Military time. I don't have my Apple Watch on right now, but I recommend that if you're just going into nursing school, you're in nursing school period, whatever, your watch should be in military time if possible. If you have an Apple Watch, just set your clock to military time. It makes reading orders so much easier. It makes looking at the patient's medications and when they're due so much easier. And when you're like doing IV tubing, it's what we use in the hospital. And if you have it with you all the time, like on my phone is always in military time. Like just do it. It's just a lot easier. I mean, some people don't enjoy it, but I feel like if you're going to be a nurse and you're going to use it a lot, it's going to be like embedded in your brain. And if you have it on all of your devices, it's a lot easier to just transition you to using it in the hospital. I want to talk about the NCLEX review app, NCLEX mastery app. This is something that I have been using during my entire time here for clinical and like in my free time. This is kind of irrelevant to this, but I mean, I didn't use this like in internship, but it's just, I want to throw it in here because this is all about clinical. But this is the NCLEX mastery app. They have tons of different quizzes. I absolutely love it. I bought it for 60 bucks for 3 months. This Med Surg one has, basically it will give you all of these different categories and you can take the quizzes on them and it'll tell you, like, you can mark like what you know, what you think you know a little bit, what you don't know at all, what you need to study. They have different mnemonics on there, like multimedia content. This has lots of different stuff. They have like heart sounds, lung sounds, practice, questions, terminology, skills, stuff like that. So I highly recommend getting this app, having it with you throughout your last semester of nursing school, and really using it. I don't recommend getting it until you're in your final semester, just because there's lots of peds, OB. Just get all your main stuff done and then start studying for NCLEX stuff. Good things about having an Apple Watch. Again, I'm not wearing it. I'm not really representing it really well. There's a timer on there. You have, like, if you use Google Calendar, which I actually started using this semester for certain things, it's really, really nice because when you're in clinical, you can remember things, because once you're in clinical doing 12s, you're basically working, like that's a job. And so having stuff on your phone is really nice, especially like the timer if you're pushing meds. It has a clock on it. What else did it have? Reminders. And texting on your watch. If you can't have your phone out at clinical and you have your watch, I know that that's bad, but this is life, people. If your phone is in range, you can text on your watch and it looks way better than you pulling out your phone. That's just my recommendation. Some hospitals don't let you have smartwatches, but I haven't had that experience. So if that's the case, then disregard what I just said. But it's just nice because it looks a little bit better than sitting there out with your phone. There's an app, there's a Quizlet that I recommend everybody get. It's, I'm gonna link it down below so you can just find it. It's a Quizlet app with lab values. It's like 52 lab values. I recommend getting it, doing it once a day. I have been doing it for a while. I really, really love it. The labs come to me like immediately, and if you're like preparing to go into internship, it's great because then you'll have every single lab value memorized. You'll be able to look at things and understand why the doctor ordered a CT, or why the doctor wanted to give blood, or why the doctor wants this test done. Like, you'll be able to just understand things better, and it literally helps. I mean, you should know these for nursing school, but who has the time to sit and do that and memorize forever? But a Quizlet's really easy. I feel like it's easy to do on your phone if you have the Quizlet app. So I highly recommend getting this ATI Quizlet. I will link it down below so you guys can get it and use it. I recommend doing it once a day. Really helped me with internship. I knew what the hell I was talking about, and I knew what I was reading through patient charts. Another big thing that I think everybody should know and look for is insulin times. Understanding your different insulins, your MPH, your Humalog, your, why can't I think of these long ones? Lantus. Knowing your insulin peaks, onsets, all that fun stuff is really, really good to know for internship in general, because you're always gonna have patients with type 1, type 2, getting insulin, giving insulin, you know, carb counting, all that stuff. So knowing when your insulins are gonna work and when they're gonna be at their highest is a really, really good idea. Another thing I wanted to talk about was understanding the difference between a primary bag, a secondary bag, piggyback medications, being able to YN a medication, just kind of understanding how it works. The primary is typically the fluids like LR, NA, D5, that kind of thing. And then your secondary is almost always your antibiotic, whatever medication you're giving. So just making sure you understand the difference between those things. We didn't have a ton of IV medication experience at my hospital for my clinicals. I didn't get a lot of experience, so I was kind of behind with that. So just knowing those things and understanding them, as well as on top of that, understanding the difference between a hypotonic, isotonic, and hypertonic fluid, it really helps you understand why your patient's getting it and why they need it. Well, are they trying to get fluid into the cell? Are we trying to pull fluid out of the cell? Are we just giving it to like gravitate? So isotonic, are we just giving it to nourish them kind of thing? Not nourish, that's not what I wanted to say, but giving them fluids essentially. Is it not going to go into the cell, out of the cell, that kind of thing. So understanding the differences. Making sure you know the scales, so like the Braden scale, the Barthel, the delirium, kind of understanding those scales and what scores would be high, what's a low score, typically what are the types of scores for different kind of patients, like just understanding those scores and how those systems, screening scales work and why we do them. Another thing, medications I want to point out, knowing the difference between laxatives and stool softeners. What is which one and why we give each one. One is to make the bowel, this is so gross to talk about, but it's true. One is to know that we are trying to make them poop, so like being constipated, and then another one is they have poop there, but we're trying to soften it and make it come out. Understanding the difference between those different meds and what the different names are is important, because your patient could be given all of those. They're gonna be like, well, why am I taking all three? What are the differences? What is what? I've been asked that question so many times, and I've literally been like, shit, I have to think about this. So if you can know that before going into internship, great, please do it. Making sure that you're using the hand sanitizer before you go in a room and right after. You're gonna need to wash your hands often, please do so, but making sure you plop it before you go in, washing your hands before you walk in the patient's room, and after you do anything with the patient. Even if you don't walk in the room, foam, walk out of the room, foam. If you don't have the foam, I'm sorry, you don't get to qualify for that. But do it anyways if you can. Make sure you're washing your hands, you're supposed to anyways. Another thing that I would say, and this is obvious, but just do this because you never know if the patient's going to ask you. I can't even count the amount of times I have looked at my medications I need to give, and I've never heard of them in my entire life. Look them up if you have a certain, like my charting system is Epic that we've had, and Epic has this thing called micromedics, and you're able to look it up and understand how it's administered, why it's administered, different ways to administer it, basically everything you need to know about the drug. Look that up before you go in the room and give those medications. If you don't know why you're giving someone something, what the hell? Like, you need to know why you're giving someone something. There are multiple times I've gone in and not known why, but like, I knew the gist of the med, you know? Like, you need to understand why you're giving it, because you should be able to say to them, this is for your blood pressure, this is for your high blood pressure, this is for your stomach, this is for this, because they might ask you, they might not. Some patients don't care, they're used to it, but some patients are really, really into their meds. I would be. I'd want to know why I'm taking something. So make sure you know before you go in and administer it, because if you don't know and you're standing there and they're like, why am I getting that? And you're just like, I don't know. They're gonna be way less like, they're gonna be way more hesitant with you, caring for them. Like, who are you? Like, why are you giving me this? You don't know why I'm getting it. So I'm trying to see if there's anything else I want to say. I think that's it, you guys. I know that that's really, really basic advice, but that is my experience with internship. I freaking loved it. And I know that not everybody gets the opportunity to have a great experience. So I'm very thankful for mine. I really do feel like it helped prep me a lot for my boards and really made me feel confident that I will be a good nurse. I did pick the right profession. I absolutely loved it. So yes, if you have any questions at all, please leave them in the comments. I'm more than happy to answer your questions, and I wish you guys all the best with your experience, and make sure you make the most of it. It's the last thing. It's the last thing you do before you are the real nurse and before you get that license. So make the best of it, learn everything you can, soak it all in, be happy, be positive, be that energy, be that, because that is what we need in the nursing field. We need those people who are truly passionate and compassionate, dedicated, driven for this profession. Be that, do it, you can, you will, it's going to be amazing. Almost done with nursing school. Real. Okay. Thank you guys so much for watching. Make sure you are subscribed. Make sure you give this video a thumbs up, and I will see y'all in the next one. Bye, guys.